to test our knowledge and understanding of healthcare operations. Let's begin to discover what the best of brains think about this dynamic industry. Starting with today's gathering, I'm happy to announce our chairperson, Mr. Sunil Kumar, CEO, EHCC Jaipur. The co-chair, Dr. Dhirendra Kumar, Professor, IIHMR University. And our revered speakers, Dr. Ravindra Karanjekar, Group CEO, Jupiter Hospitals. And Dr. Suresh Adwani, Dean, Faculty of Management Studies, Mody University. I would request you all to kindly come over to the dais. Mr. Sunil Kapoor has a rich experience of 31 years across a variety of functions, including healthcare operations, supply chain, and IT. He is currently leading Eternal Heart Care Center as the CEO. Previously, he spent 15 years in healthcare operations in Fortis Healthcare, in different roles, responsible for a number of branches in Amritsar and New Delhi. He has been awarded the Best CIO by DataQuest, Best IT User by NASSCOM, and Best HIS by PC Quest. We are honored to have you here with us, sir. Our co-chair for the session is Dr. Dhirendra Kumar, Professor, IIHMR University. He is a population and public health professional. Sir has obtained his PhD in population studies with specialization in mortality and public health, and Master of Science in Statistics. He worked as director at the Institute of Health Management Research, Bangalore, from July 2012 to July 2014. Dr. Kumar has gained rich experience in leading multidisciplinary team of experts in implementing health and nutrition programs in Afghanistan as country health and nutrition program manager. I'd like to introduce our venerated speakers to our fervent audience. Our first speaker, Dr. Ravindra Karanjekar, Group CEO, Jupiter Hospital, has been in hospital administration for 30 years now. He has worked with Lilavati Hospital, Bandra, Fortis Hospital, Mohali, D.Y. Patil Hospital, Nerul, Wockhardt Hospital, Mulund, and Global Hospital, Parel. He is also the chairman of the NABH Accreditation Committee and alumnus of Tata Institute of Social Sciences. May I request sir to come over and share his views on healthcare operations.
Good morning, everybody. Yeah, welcome on the second day. The opening batting is started now. I think today also we have a T20 in the evening, so we'll be free in the evening as early as possible. This is one area, after having stint with about 7-8 group of hospitals, right from Fortis, Wockhardt Group, Global Group, now with the Jupiter Group. I could see that in the healthcare, there is a dearth of good, skilled managers. People like you. I have seen my students or the previous batches from IIHMR also rising up to the highest level and managing the hospital. And this was possible only because of very systematic learning, a good experience, and will to change the things. If you can do that, you can achieve probably the goal which has been set by the promoters of that hospital. Whenever I come across various hospitals, or last 1 year or 2 years I have seen, at least yesterday as I told, 15-20 hospitals which are on the verge of closing down. And these are the big ones. 300 bed, 400 bed, 500 bed hospital. At some point of time, there are big chains of hospitals of 2000 beds not being managed properly. They are on the verge of either sellout or closing down or changing the model completely from maybe from full-timer to the visiting to the part outsourcing or not outsourcing but even totally selling out the thing or starting particularly half things in the medical and half in non-medical. This all happens primarily because not managing the hospital properly. Operation management is basically the science and art together to run an organization. And what is at the core of it? If you see, the core of it is the patient satisfaction. We say a lot. If you see the taglines of all best hospitals, group of hospitals, everything, which always said it is affordable care to the patient, patient first, patient safety, all these things are being the taglines of various hospitals. But ultimately, if you fail to recognize that center of your all activities is the patient, you will fail to achieve your goal, mission, targets, everything, and eventually at the some point of time, you will be a loser. Operation management entirely, let me tell you, at least I must have seen probably in India highest number of chairmen in this country of various groups, had an interaction with them, everybody. Each one of them says, when I joined as the CEO or the group director or executive director, each one of them tells me, my patient should be happy. Do anything what you want to do. If my patient is not happy, I don't think the operations are doing well. Money is secondary to me. And most of them really mean it. Money is not primary to them. Money is secondary to them. And as I see from the operations, when you have the patient satisfaction, this satisfaction leads to the perception in the people and the community around as a good hospital. Hospital caring for the patient, hospital caring for the patient's safety, hospital caring for the patient opinion. This perception leads to more and more patient. All other marketing on one side. My all previous 3 chairmen were saying marketing department is not required at all. If you get 500 patients now and each one of them tells other patient to come here or promotes other patient to come here after being satisfied in the organization, you will get double number of patients more than what a marketing department can do. And it is really true. So patient satisfaction becomes the most important factor in the organization operations management. How do we achieve it? There are multiple steps for that. Before that, what are the other core areas which we need to look into when we are doing the operations management? One is the financial stability. Most of the good decisions which in the beginning stage of the hospital taken earlier are reversed because the money is not there. Most of the time, and mark my words, when you go into the market now or when next 5 years or 7 years, 90% of the hospital which I started about 8 hospitals in this country. Right from the Global to Fortis to Lilavati, all of them. And I was the person who started them. I was the person who started the systems for them. All of them, when they presented the documents to the bank, they said, this is our phase 1. After we reach a particular number or a critical size in terms of patients, we will be going for phase 2. Hardly, not even the 10% of the hospitals have started phase 2 on time, and not even 50% of them have started at all. Financially, after first or second year, there were exaggerated claims, there were exaggerated revenues projected to the bank which were not achieved. Ultimately, the bottom line was under pressure. They were making losses after losses, and this has led to asking the management, who were the CEOs or who were the chief operating officer, asking them that how do we make the money? And for that purpose, whenever we propose for the phase 2, they said there is no money right now. And if you pressurize too much for that, then they will ask return on investment, how much it will be done, and lot of other 100 questions. The sum total is that phase 2 doesn't start at all if you are not financially stable. Third core component of operations management is the quality. You can deceive the people for some time. Your marketing, dazzling advertisements, meeting the people, telling lot of tall claims, giving into the newspaper or on your pamphlets all your USPs, how great you are. All that is okay. You are great today, tomorrow somebody else is great. After 6 months the same machine is with somebody else. So you are not alone in the market to have that. But you can sustain the patient satisfaction, the financial stability, and the quality which is there inherent in an organization will be able to take you forward. When we talk of good restaurants, when we talk of good educational institutions, when we talk of good hospitals, we really talk about our perception of that hospital regarding the quality. If the quality is good, then it is always possible that you will achieve the impossible. I will dilate on that little later. And the last is when you are managing the hospital. In the operations management, two most important factors are there. One from the cost point of view and other point from the human relation point. They are the people and the material management. If you can manage, I have seen hospitals, I have seen the biggest hospitals in this country, worked as the CEO there, who had the best of the people in the country as the full-time consultants. People could not be managed there. The money was a problem. At certain point of time, people started leaving you. Today, if you analyze the revenue of a hospital, 85% of the revenue of any hospital, take it any hospital in the country, is earned by 5 or 6 top doctors. Even if you have 100, 150, 75 doctors, full-time doctors or visiting doctors, remember those 5 or 6 doctors matter to you. Those departments, only 3 or 4 which earn you 75 to 80% of the income. If you disturb those doctors, if you disturb those dynamics between those departments and other departments, because there is always a demand. I remember all doctors, right from the skin dermatologist, anesthetist, pathologist, to the cardiac surgeon, liver transplant people, all of them, the people who are at the outer periphery, they always feel they are neglected. It is not neglected. It is the importance given as per the weightage you are contributing to the hospital. And then there is a demand that everything should be equal, all doctors should be equal. No. While running the hospital, you will have to manage the people according to the weightage what they are giving. That does not mean that you are neglecting others, but that does mean that you are caring for the important people who are contributing to your salaries, contributing to the hospital's benefit, contributing to the hospital image much more than the other people. You have to care for them. So the people management and material management, these are the two important things. If you see, I can tell you, if there is a letter or maybe an inland letter or maybe some stamp of 5 rupees down on the floor, you may not go down and pick it up or use it. Let it be there. It's a 5 rupee stamp. But as against that, if it is a 5 rupee note, you will immediately pick it up. The attitude towards the real money and the money in terms of material need to be changed. As the managers, you all must value the material as good as money. If you don't value the material as good as money, you are bound to lose, and the wastages, pilferages and unnecessary use of the material will lead to the downfall of the hospital, will have a pressure on the bottom line, and definitely only the big top line, as yesterday Anirudh was telling, people looking at top line. Yes, people look at the top line. I had a very deceiving exam. One of the hospital when I was running, we made it operationally break even within about 100 days. It was in Ahmedabad, and I was very happy. Next month my revenue rose up by another 50 lakhs. So I went to the chairman. I told him that, look here, we have a good revenue this month, and our top line has gone up by about 8% this month. Then he asked me, what is our bottom line? Oh, bottom line was less by about 5%. Even though top line goes up, bottom line is less. Basically, it was a cardiac hospital. The number of stents or the number of angioplasties went up into that month. And when the consumables went up, automatically cost of stent was included into the bill. I had another 10 or 15 stents added to the month. So I had another 15-20 lakhs additional revenue. But that did not contribute margins to the bottom line. So not only you as the managers will have to have an eye on the material, eye on the money, but at the same time you will have to train your people. You will have to train each one of them on how you use the material, how much it is valued, and if they save the money on that, it will benefit the hospital. If you don't do that, there will be indiscriminate use of material, which ultimately lead to the losses. So another core point, as I said, was the people and the material management. So we start with the quality and the patient safety. This is the most important thing. Two big hospitals standing next to each other. Patient decides to go to one hospital and doesn't go to the another hospital. Or even after a lot of marketing, still the referral doctor or referral consultant want to send a patient to a particular hospital than the another hospital. Or patient searching on the net, searching on everything, looking at the various reputations of the consultants, and nowadays patients, especially patients coming from abroad or the patient coming from urban population, have become much more intelligent. They search on the net, they call the doctor, they ask for their results, how much cases they have done earlier. I remember when I was with the Wokhart group, and we were one of the two hospitals which got JCI at that time in the country, and we have started getting patients from US. One of the patients from Southern American states had come to us, and that time I had a CEO coming from insurance company from US. He has come to visit us and empanel us for their patients. So I was very happy that I had an American patient, so I called him and asked him to talk to him. He came there for the joint replacements, and he asked him that, why did you come? Because his impression was, first-hand impression was that he must have come for the want of money. The cost in US was much more higher than the cost in India. The fellow said, money is one part. Money is no problem. With a heavy accent, these people talk in very heavy accent. Money is no problem. I came here because doctor is good. He said, how do you know? He said, I talked to the doctor in US. He has done last 1 year only 12 surgeries. Out of that, 9 were successful. While this doctor in India, which I talked to him, he has done about 230 surgeries. Out of them, 215 are successful. I think I am in better hands. Money is the secondary part. I definitely benefited about $1,000 to $2,000 by coming to India, but that was not the reason. The reason is I wanted the best health, best services, quality services, which I thought available in India, this hospital, so I have come. The ultimate purpose is that if you give quality treatment, if you deliver the quality health services to the patients, patient will be happy. Ultimately, they will lead to your patient satisfaction. Patient satisfaction will lead to the more and more patient, which will lead to your financial stability. So you must look at the quality as one of the core component for the patient satisfaction. If quality is not there, I don't think you will go to a good restaurant, you will not send your children to the good schools, you will not go to a good hospital. Quality has to be there. And quality in by and large becomes a perception. As a common person, common man, I can have, that is what one more thing I would like to tell all, as well as the staff happy. If you don't pay them, if you don't replace the thing in proper time, if you don't, finance is not for finance purpose. Finance is an instrument to provide an environment in an hospital, an ecosystem in an hospital where the people are happy to work. I have seen hospitals where people wanted to leave the hospital tomorrow, but as the opportunity was not there, people are not leaving. I have seen the hospital where people are there right for last 10 years, 11 years, 12 years, whatever may happen, and they feel the hospital is their own. Even though it is owned by somebody else, it is their own hospital, and they are 100% sure that everything in this hospital will be done for me. These are the two different things. You create a family environment in an hospital, or create an employee-employer situation in the hospital where you are stuck by the rules and you go by the rules. I don't say you don't go by the rules, but while going by the rules, you develop such an environment that people don't leave you. That becomes a part of your retention policy. I will come to that. So when you are talking of quality, you are talking of performance indicators. As of now, NABH, which is the apex body for the quality in the country, Dr. Kalra is here, who is heading NABH in this country. Dr. Gyani, who started the whole thing. I was also a part of NABH for almost 5 to 7 years. This has given us the quality in healthcare, how it should be and how it should be maintained.
Good afternoon, all of you. I, Dr. Shama Singh, welcome you all after a refreshing tea break. Thank you all for sticking to time. I hope you all are feeling rejuvenated as we are entering our next technical session, which is based on Blue Ocean Strategies. Blue Ocean Strategies provides a systematic approach to innovation. Its actionable framework, tools, and processes guide healthcare industry to maximize opportunities and minimize risk in pursuing value innovation and creating blue oceans. Ladies and gentlemen, we rarely get this kind of opportunity to listen to the words of great knowledgeable speakers. I feel privileged to invite on stage our speakers for this session to give us deeper insight into this topic. I invite on stage Dr. Soumitra Ghosh, CEO, Wish Foundation, New Delhi. Mr. Rahul Sharma, Wish Foundation, New Delhi. I would also like to invite on stage the chair for this session, Brigadier Dr. S.K. Puri, advisor, the IIHMR University. Dr. Anila Kawal has come. I request the volunteers to do the floral welcome to the dignitaries. Dr. Soumitra Ghosh, Dr. Rahul Sharma, I would like to introduce the chair for the session, Brigadier Dr. Swadesh Kumar Puri. Dr. Puri is an expert in health administration. He has a long experience of working in hospitals and teaching institutions of Army and was awarded Vishisht Seva Medal by the President of India for distinguished services rendered as Director of Medical College and Hospital, Jaffna, Sri Lanka. I request Dr. Puri to sail us through the session.
Okay. Thank you very much and good morning, ladies and gentlemen. This session is on Blue Ocean Strategy. This concept came to light after two management gurus wrote a book, Blue Ocean Strategy, to create uncontested space where the competition becomes irrelevant. After this concept came, and the main concept, the main idea is value innovation. That you have to make values for the customers, value for the company, and value for the employees. So that is the main thing, that you have value innovation, and then you have the uncontested market where competition becomes irrelevant. It has been, it has got a lot of advantages over the old Michael Porter's model, 5 forces model analysis. And now Blue Ocean Strategy is becoming very, very popular because it creates brand which can last for decades. And since healthcare industry also is a price-driven commodity nowadays industry, so they have applied in the healthcare industry also, that you create uncontested market and where the competition is not there, because now healthcare also, private sector, there has been tremendous amount of competition, and that where a lot of competition is there, they call it red ocean. That's a red ocean where blood is all there in the water. So Blue Ocean Strategy, we have two very eminent scholars, Mr. Soumitra Ghosh. He is the CEO of the Wish Foundation. Wish Foundation has been in great news in Rajasthan. I've been reading about Wish Foundation. I wanted to meet him in newspapers, and I asked him a question immediately, because whenever I read a newspaper, that question used to come, that from ATM they will deliver medicines. For Schedule H, you need doctor's prescription to deliver medicines. So how are you going to do it? So he gave me the answer, how is he going to do it? I think he will tell you all that, because we are doctors, and so far we only knew that for any Schedule H medicines, you have to write prescriptions, and then only medicines will be given to you. And then sitting in Jhalawad, some distant village, ATM machine will deliver medicines to the people. That's a great innovation. And that's blue ocean. So Mr. Ghosh has got, is a great innovator, expert in strategy, 30 years experience in various countries, Africa, Southeast Asia, Latin America, and they have also taken over PSCs and CSCs on PPP mode. So he's an expert on public-private partnership also. Public-private partnership, always we used to think that there is no PPO model which is successful in India, because government is a tiger and private partner is a sheep, and government will eat the sheep. So we always used to think in those lines, and so he will tell you how he's made a different model and how he's going to go about it. And especially with that ATM machine, that without prescription, how is he going to deliver medicines to the people? Over to you, sir.
Good afternoon, everybody. And so this is my second Pradanya. It's about a year back that I had come here. And that was a game-changing session for Wish Foundation. And I'm really grateful to IIHMR for inviting last year and re-inviting me this year too. Talking about Wish Foundation, as Dr. Puri was saying that, he read it in the paper. I really get scared when people say that, read it in the paper, because there are lots of agitations happening about what we are doing and what we are trying to do. And I have to take it in the positive stride. So people agitate, or people saying something, start talking about things which are either good or bad. So it's nothing in between, nothing average. Hopefully what we are trying to do will come out to be a positive thing, and it'll make a huge impact in the state of Rajasthan and other states that we are working in. Interestingly, this terminology, the blue ocean strategies, is yet another, I won't say jargon, but yet another description or analogy of various kinds of work that has been happening in the commercial sector as well as the non-commercial sector. So it's nothing new. It's being repositioned, it's being repackaged and represented in a way that becomes relevant in today's context with all these young minds floating around. So I'll basically not go into the theories of, you can just look into the Google search and get all the dopes on blue ocean strategy. Just as a precursor, I will say a few words about what I understand of blue ocean strategy, and then how this has been implemented or this has been tried out in the healthcare sphere. Before I get into that, Dr. Gupta, I have one question from my wife, that why do you have to be called on a Sunday only? So before I leave, I must get an answer from you today. Okay, so this is the blue ocean strategy of IIHMR. Okay. Okay. So, should I just press it and it will work? So, let's start with the terminology blue oceans. When you think of the blue oceans, when you think of the color blue, what comes to your mind is a cleanliness, absolutely clean ocean. So the blue oceans are essentially what it implies is that you're looking at something which is a fresh, absolutely fresh outlook that you're talking about. And it's not a bloody ocean. It's not a muddy ocean, okay? So it's this whole comparison between the blue ocean versus the red ocean comes because the red ocean is really a bloody, because there's so much of blood has flown into it that, with the competitive, fights going on there for ages, and people are trying to make little differences just to, snatch market share from each other. So we are talking about clean oceans. How can we create clean oceans and not focusing on the bloody oceans? Essentially, therefore, what we are talking about is the unknown market, which is still untapped. The needs are there. You need to create some wants and then create demands for it. And so it's you tapping into or creating a new demand. So sometimes it has been called market development, sometimes it is called development, sometimes it's called need creation, etc. But the need exists, we all know. The need exists. How do you sort of bring that out, at a higher level of consciousness and provide the wants, create those wants which can satisfy those needs. And the package that you create with the 4 Ps ultimately creates the demand that you're looking for. So it is the demand which is created rather than snatched. I'm not really looking for something out of my existing competitors. I'm trying to create a horizon, redefine the horizon which is different. And it happens and it becomes scalable kind of a strategy when it has an ample opportunity for growth. So therefore you make the profit, you make, and you grab that market rapidly. I mean, if it takes 30 years, 40 years, business people will not sort of, appreciate that. So it has to be a time-bound kind of a potential that you can tap into. But in this manner, what happens is you are actually leading the competition. You're creating competition. You leave the existing competition irrelevant. And so thereby, you create a market, you create a segment which is all for you to be tapped, and then comes the followers who start coming into that. So you will have competition. So it is not going to be something which is one-time kind of a strategy. It has to be a continuous. So when we talk about innovations, today the innovation is no more a buzzword. People have started getting into this word that what does it mean? How do I sort of imbibe that into corporate culture? So it cannot be just one innovation and you've made a big bucks and that's it, you quit. It has to be a continuous process. It has to be a strategic process so that it sort of keeps producing those new ideas, the new ways of redefining the markets and the solutions. One other thing is that, when we are talking about blue oceans, again, we are not necessarily talking about invention per se. We are talking about probably innovations more often than not. And so by innovation, there could be blue oceans within the red oceans. And so identifying those gaps, identifying those differences, and creating those differentiators is really what blue ocean strategy is all about. So it is doing it differently, doing it better, with an ulterior objective, a better purpose, is what is blue ocean strategies are meant for. So what happens is the structure, boundaries exist only in a leader's mind. Dr. Gupta had this thought long back about the health education, okay? Not everybody saw that. Not everybody could see that. But these are the leaders, these are the game changers who have these kind of things in their mind. It's very difficult to put on paper at a point of time so that thousands and millions of people can see it. And they see this as a demand which is existing, and it is largely sort of untapped by others. But it's something which can be tapped into. There's a possibility. I mean, traditionally, if I have to give example, it is more from how we have moved from the supply to the demand-driven kind of marketing strategies. So earlier it is like, you distribute condoms, people will use it. That was the assumption. But over a period of time, we realized that just the availability of condoms need not necessarily increase the usage of condoms. There has to be a demand created. Now, this is a shift in the paradigm of thinking, and that is, again, part of the blue ocean strategy. So it doesn't have to be completely a new thing or a earth-shackingly, different kind of a thing that you have to come up with. Some very basic process changes can also be considered as blue ocean strategies. There are basic few factors like, you have to create a difference. You have to continuously look for the difference, and a difference which is low cost, which offers a value, a tangible value to the end user who is going to adopt that particular innovation. And it becomes very critical to keep these two factors in mind, that am I differentiating myself? And am I differentiating for the sake of differentiating? Or am I differentiating with a tangible value that will be seen by the end users as something which really makes a difference, which will really improve the way of life of those target groups. And this way, what happens is it expands the boundary and the new wealth is created. So some people who were not using a product or not using a service suddenly becomes. Now, this is not limited to any particular thing that, insurance. So the financing of health, delivery is something that is the only area. So if you look at it from the patient care, that how do we deliver quality patient care to the last mile, okay? As compared to educating the healthcare providers, you can look into the empowering the patients to actually seek health behavior, monitoring patients, monitoring health workers, financing patient care. Financing definitely is a big component. All these areas require fresh thinking. And in the context of when we are talking about universal health coverage, that is the real challenge, or that is the real solution. That, how can we redefine the existing group?
Which we are struggling for quite many years. And every time what we do, maybe the solution which the technology was not available, but now we have. So we are the privileged one, the generation which we are in. We are the privileged one that we have this powerful technology available with us to address these major bottlenecks which we are still struggling. We have trained our A&M so many times. But when I go to the field, I have seen hundreds of A&Ms register a woman delivering with a weight gain of 4 kgs. How a human baby, a human child be delivered with a weight gain of a 4 kg? That means that even when she is fuzzing the data, she does not know what and how to fuzz it. That clearly shows. Despite imparting so many trainings, we have not even able to communicate a very simple message to our frontier, to our frontline army person in the healthcare, public healthcare system, that how much weight gain a mother should get during these 3 trimesters. And even if she knows, she's not using it, she's not practicing it, then why? What are the reasons? Why and how can it be addressed? Similarly, I have seen many women who come to, and I have seen one sincere A&M in Talk district when I was visiting. She was so sincere, she was doing everything as per the guideline one should do. She measured the blood pressure, then she did the urine examination. Then I asked her, you did blood pressure, you did urine, and there were many. It was written also, and she was doing also when I went. About